Hello, everyone. Today, we're kicking off the 16 Days of Activism Against Gender-Based Violence, an annual international campaign that kicks off on the 25th of November. That is International Day for the Elimination of Violence Against Women, and ends on December 10th, which is Human Rights Day. This campaign was started back in 1991, and yearly it's celebrated as a moment to call for action to prevent and end all forms of violence and harassment against women and girls. Today we have with us Chioma. She is a gender specialist from Nigeria and a 2022 Heroine of Health. She's with us to talk about her work, her campaigns, her activism against gender-based violence, and how she's approaching this very complex but very, very important issue in her home country, Nigeria, and what are her recommendations for the international community. So I'm going to let her introduce herself, as she's going to do it much better than I am. And I'm passing the mic over to you, Chioma.
So my name is Chioma Oduenyi. I work for Japaigo in Nigeria. I am a gender expert. I am currently the project director for USAID-funded Momentum Country and Global Leadership Project, which is working to end all forms of gender-based violence, particularly against women and girls in Nigeria, focusing on 2 states in Nigeria. I'm very pleased to be with you.
Oh, perfect, Chioma. Thank you very much for the correction, and I'm sorry on my side for that. I wanted to first ask you if you could put us a little bit into the context of the problem of gender-based violence in Nigeria. How prevalent is it? What's the biggest issues around it? Tell us a little bit more about gender-based violence in Nigeria in general.
Okay, so thanks for that question. So the issue of the topic of gender-based violence, as we all know, it has become a global public health issue and social issue. So the same things that happen all over the world, Nigeria also has its fair share of this problem. In Nigeria, we have the Demographic and Health Survey that puts GBV when you look at statistics, that 3 out of every 10 Nigerian women have suffered one form of gender-based violence or the other since age 15. And when you begin to tailor down to different types of forms of gender-based violence, when you look at intimate partner violence, which can include sexual violence, emotional violence, physical abuse, socioeconomic abuse, it even gets deeper. Then you begin to see that a lot of women who are aged up to 49 years have, several of them have suffered this violence in the hands of their intimate partners. When you look at some statistics around young girls, a lot of young girls, the statistics also have it that have had their sexual debut being through rape. So we have these statistics that 1 out of every 4 girls have suffered sexual violence in Nigeria. So these numbers are quite high, and that goes to show us how prevalent the issue of gender-based violence is in Nigeria. Nigeria, when we look at it on a national scale, this is what the statistics puts it to be. However, when you also begin to look at individual states, it doesn't get any better. The issues are the same all over the country, irrespective of where you're coming from. You would think that maybe if you go to some parts of the country where they are educationally advantaged, you would see it different, but no. So the problems of gender-based violence does not respect social class. It doesn't respect educational status. It cuts across anybody can be a victim, anybody can survive GBV. So it's a national problem. It's a big problem, facing us. There is also a bigger problem about gender-based violence in Nigeria, which is the problem around the social and gender norms that makes people hide, problems of GBV. So it's highly shrouded in secrecy. In as much as people are beginning to speak out, and there's a lot of attention around GBV, still the gender norms and stereotypes that we have in our societies continue to make a larger number of our population still hide, issues of gender-based violence, which is also a bigger problem on its own. So I think the prevalence, as I have listed, is quite high in Nigeria as a country.
Wow, yeah, it's impactful to hear this figures world around, and in Nigeria, it doesn't change. Women are being affected by this issue everywhere, and we in Women in Global Health focus a lot around the women in the health workforce. So we wanted to ask you, what is the situation of gender-based violence within women in health? Is the 1 in 3 overall figure applied to health? Do we have any figures around it, or is this a territory that has not been explored further in Nigeria?
Okay, so like I put out the statistics as we have with our National Demographic and Health Survey. At the moment, even research around GBV is still quite rudimentary in Nigeria. We are still not at that place where we can boast of, having researched all forms of GBV and in the spaces where it occurs. So in women, looking at women in the health workforce, the NDHS didn't really put out the figures, or didn't go out to look at, explore, how GBV affects women in the health workforce. However, a lot of these are also by extension and can also be extrapolated from the lived experiences of women in Nigeria in different spaces, from the private spaces to public spaces where they find themselves, because of the underlying patriarchal issues and social norms. You find out that sexual harassment, for instance, which occurs a lot in work spaces, also affects women who are in the health workforce. So in any way you look at it, even though we don't have those very hard statistics to back up the amounts of gender-based violence for women who are in the workplace, in the health workforce, but in the overall workspace for women, women have reported issues around sexual harassment, intimidation, not being given their rightful places, all manner of psychological and emotional violence, physical violence at the workplaces. So it also affects, so if it affects women generally in the workspaces in Nigeria, I believe that women who are also within the health workforce will also have their own fair share. And if we can also look at it, you have a lot of women who are, the health workforce is made up of more women than men. And we look at the issues of gender, how women are also being placed when women are believed that they should be doing the work, but when it comes to occupying leadership positions, it should go to the men, So these are also some forms of concerns that we can also explore when you look at GBV at the workspace for women who are in the health workforce. So I can tell you now that just as it happens for every other person, women have also been reporting issues of GBV within this space of health management and service delivery.
I think you raised an excellent point here with the leadership and the whole thing of women ending up in lower paid positions and are just subject to, you know, the whole game that's played around power. And definitely, I'm sure the statistics are the same or even worse than in the general population. I wanted to ask you, what impact do women that face gender-based violence have? What's the impact of it on their lives, on their mental health, on their futures?
Okay, and I think I missed the last part a bit, but
Okay.
if I got you right, you asked what impact does GBV have, or would you repeat your question again? Because I think the internet made me not to hear the
Oh
whole part.
no, don't
Please
worry.
repeat it so that I
Internet
can
connection
answer.
problems are super common. Definitely, I think you were right on the thing that you heard. It's what is the impact of gender-based violence on the women that suffer it?
Okay, so gender-based violence, by definition, we know it's you know, something that is done to anyone because of their ascribed social differences, and it's a human rights violation. When there is power asymmetry and someone is in higher place of power, then that power is used against the other. So if we all understand what gender-based violence means, and we juxtapose it with the human rights violation concern of GBV, then obviously the impact for anyone who suffers it will be quite immense. So first of all, nobody deserves to go through any form of violence. We are all entitled to the fundamental human rights. And one of such freedoms is that you are free from all forms of violence. So why should any human being suffer, you know, for the actions of another human being, suffer any form of violence at all? So it has huge impacts depending on the type of violence that someone has survived. If anyone survives on the person's complete well-being, if anyone suffers sexual abuse, it has huge impacts on the person's health, on the person's entire well-being, mental health, and what have you. If anyone suffers emotional, psychological, socioeconomic abuse of any sort, it's a whole human being. It's one human being, you know, that is going to have different dimensions of sufferings that we may not see. So the impact is huge for anyone who suffers any form of gender-based violence. And that's why, you know, the issues of gender-based violence have been established to be a growing public health issue. Because if you look at it from any population group who suffers GBV, for instance, let's look at it this way. Any woman who is in an intimate relationship suffers gender-based violence from their intimate partners. They are at high risk of contracting HIV/AIDS. They are at high risk of, you know, not using modern contraceptives to plan their families. They are at high risk of death or murder, you know, evidence shows that about 40% of women who have been murdered by their intimate partners. That's a huge impact. Women who are pregnant, who suffer gender-based violence from the hands of their intimate partners. Evidence has shown that when they are pregnant, it increases. You would expect that it should be on the decrease. But when such women who on a regular suffer intimate partner violence, when they are pregnant, it turns out that it increases. And when it increases, this woman is at risk of unsafe abortion, miscarriages, you know, so many health complications that can come out of that. This woman, the fetus is unsafe also. It can lead to stillbirth, you know, premature delivery. It can lead to death of the unborn fetus. So if we look at it from that angle, it's huge impact for that woman who suffers intimate partner violence. If you look at, you know, others who will suffer sexual violence from non-intimate partners, rape is something that nobody would want to imagine it. You wouldn't even wish even your enemy. So we've read accounts of women who suffered this from a very young age. It lives with them, you know, throughout the entire course of life. So it affects people. It can affect people that they are not able to get an education because they are having mental challenges, psychological challenges, you know. It can go, the list is endless. It's even, it goes either way. It can make monsters out of the people because many of them wouldn't understand why they should be living. Then it can lead to people becoming suicidal. You see, some of these women would prefer not to live than to live with that experience. So if any form of gender-based violence carries a huge impact. So as human beings, as societies, the earlier we begin to call a spade and look at issues of gender-based violence as a human experience, you know, that affects human beings, and stop paying lip service and, you know, take action, then we will continue to lose a whole chunk of the population to this menace. It indeed carries a huge negative impact to anyone who suffers GBV in any form.
You're definitely right. The list is completely endless, and the effects can last a lifetime. And on the topic, you talked about action, and we know you work a lot on gender-based violence. Can you tell us a bit of your work, how you address it in Nigeria, and what would be your recommendations or your takeaways for other governments to apply the same way of working around this really complicated and intricate issue?
Okay, thank you very much. Yeah, so let me take it from the work that I currently do. Like I said at the beginning, I lead a project called Momentum Country and Global Leadership, which is funded by the USAID. And this project is dedicated to working to prevent and respond to gender-based violence. This includes reducing child early and forced marriage and promoting early adoption of family planning. And this project, when we started, of course, evidence have shown us what the problems are, what the barriers are. There are huge barriers around social norms, you know, being one of the drivers of gender-based violence. So what we did was to embark on some formative assessment pieces where we did what we call social norms exploration, because this GBV is within people and happens within us as communities and society. So we had to engage with the communities and the society to look at those norms that continue to drive gender-based violence. And when we identify those norms in those communities where we work, of course, we started engaging with the people to design programs that are targeted at transforming those harmful and discriminatory gender norms. And we didn't just work with the communities, we were engaging the local leaders, engaging governments at different levels, starting from the national level government. In Nigeria, we have the Federal Ministry of Women Affairs that has the mandate, the federal mandate to work to address issues around gender-based violence. So they are our key partner. And of course, we also work with the Federal Ministry of Health, who also work in all the health facilities around the country. Because for us, we look at GBV as a complete package of primary prevention, which includes response, primary and secondary prevention, where we're able to also make services available for those who have already survived GBV by ensuring that there is access to quality services at the different service points where they may need help from, including particularly the health facilities, which evidence have shown that most survivors of GBV visit health facilities first and end up, sometimes they end up, maybe that may be their only contact, the health provider, who helps to treat physical injuries in the case where there is physical injuries, and who also helps to provide services in the case of rape and what have you. And of course, link them up to other non-clinical services that they may require, which includes legal services, law enforcement services, social support services. So in our work, several people have actually been doing several things in different places, small, to address this issue of GBV. But when we got this platform, we tried to see how we can bring stakeholders together to begin to look at the issues in a holistic manner. So we have continued with engagement with the critical stakeholders, which is very important because GBV is not an issue that is treated in isolation. It's no one organization can address all the needs of a survivor of GBV. So we need to recognize that first. And service providers must also recognize that we need one another. So it's not a place where we should be competing. It is a space where we should be complementing one another. So one of the targets of my project is to create platforms that bring key stakeholders together to find better ways of providing survivor-centered GBV survivors. Then also on the prevention side, like I said at the beginning, when we embarked on the social norms exploration, it helped us to gain insights on what works in communities to drive GBV and to have targeted interventions that can lead to prevention. Again, prevention is better than cure. We would actually want GBV to be prevented in the first place. So USAID is magnanimously, giving us funds to target prevention activities. So we are working in communities to address some of those norms that drive GBV, which we identify through that exploration. Then, of course, engaging with multiple stakeholders in the service delivery space to ensure that these stakeholders are well-trained, the first responders are well-trained, the policymakers are making the right policies, engaging with everyone. In Nigeria, there has been a lot of traction around addressing GBV. I think the Federal Ministry of Women Affairs have been leading from the front, to ensure that the available laws are being implemented. We have, when we look at the different aspects of this work, looking at legal provisions, and policy frameworks available. We have a couple of laws that are already in place in Nigeria. Sometimes the problem is implementing, and there have been sustained advocacy for some of these laws, like the Violence Against Persons Prohibition Act of 2015, for all the states of Nigeria to be able to domesticate them, and not just domesticating, let those laws be into use so that anyone who survived GBV, who desires to access justice, can have access to justice. And we're also engaging with the Nigeria Police Force in different forums. They are the critical stakeholders. So I'm just making a list of some of these key stakeholders that we engage with and work with, because they have the mandate to be able to provide law enforcement. And if there is need, any case, to arrest any perpetrator, the survivor cannot do that by herself. We need law enforcement. So in Nigeria, we have two arms of government, the Nigeria Police Force and the Nigeria Security and Civil Defense Corps, whom we're also partnering with to provide that aspect of care. And of course, the social support services that are available, different people are providing one support or the other. The Ministries of Women Affairs are there providing social support services, empowerment services, safe spaces, for survivors who need temporary shelter in such cases. So basically, we look at this issue in a holistic manner so that the little we can do, we're able to do it well. The few survivors that we can provide services to, they are able to receive quality services. And the communities where we work, we're able to work with them to help them take action and transform some of their norms that are discriminatory and harmful, and hoping that in no distant time, we should begin to see changes in those norms and see reduction in gender-based violence. Thank you. You're muted, Anna.
Yeah, sorry. I hear you. Definitely collaboration, prevention, work across all fields. This is a holistic approach that should be taken. And here's my last question to you. We only have a few minutes left today. So what would be your high-level message to other governments that want to address gender-based violence? If you had to sum it up into one or two phrases, what would it be?
Thank you. So, for me, being an advocate and someone who has been in this field, trust me, I have worked with governments, non-governmental organizations, and I've seen, how everyone is jumping on at the topic of gender-based violence. One important point for me, let's not just do this for the gram, like we'll say, or for the news. Can we put our minds and our hearts to this work, recognizing that justice for one is justice for all? Governments and their representatives, this shouldn't be about ticking off activities. Oh, we've done so and so activity to mark this year's 16 days of activism. We should keep interrogating ourselves and what we are doing, asking ourselves, are we able to reach survivors of GBV with quality services? Are we able to stop GBV from happening by ensuring that we're engaging with communities to transform discriminatory gender norms and those norms that are harmful? As we remain in these patriarchal societies, most of our leaders are men. Everyone is jumping on the bandwagon. Oh, we want to end GBV. We need to tell ourselves the truth first. How many of us even believe that we can do this or we should do this? So for those frontline leaders, we should all remember that we are all privileged to occupy these positions. And millions of women and girls out there are looking up to us to use our voices and the platforms that we have and the positions that we occupy to ensure a world that is violence-free. No one deserves to suffer gender-based violence of any form. So in reading it out, maybe step-by-step actions that we can take. Leaders should support laws and policies that create an enabling environment for perpetrators of gender-based violence to answer for their crimes. They should not be protected. Those policies and laws should also be there to work for survivors of gender-based violence to be able to access justice when they need it. Perpetrators should not be protected by any organ of government. Then, irrespective of whoever the person is, the laws should work. Then, of course, we should also be able to make sure that our services are ready to provide the needed services. So we must strengthen our infrastructure across all service areas. Our first responders need to be trained. They need to be trained. Providing services to survivors of GBV is a special kind of care. So those who are occupying those positions need that capacity building. And the entire society or community need to be sensitized and engaged in how they must drop norms that continue to hurt us and drive gender-based violence. If we can do a bit of all of this, then we're on our way to making our societies free from all forms of gender-based violence. Thank you.
Oh, Chioma, thank you. Thank you for everything you've taught us today. You're really a role model in a topic, and a lot of countries have a lot to learn from what you're doing and your work at the moment on gender-based violence. As you've said, this is a very prevalent issue. A lot of women will suffer from it at some point in their lives, 1 in every 3 to be more exact. And this is a really good moment to bring it up, a really good moment to call for action. But as you've said, the advocacy doesn't end with the 16 days. It's an ongoing process, and we should be advocating for women and girls every day. And well, thank you everyone who joined us today. You can follow us on social media at Women in GH. We will be doing some campaigning around the issue during this 16 days and on the year to follow. Thank you.